Well, for those of you who've heard me speak before on this topic recently, it was a 3-hour dissertation in front of Senate Medical Affairs, and so you know that 10 minutes is sort of tough for me. And so I've only got 2 slides, and I want to talk about those 2 slides because I think they really get to the crux of what we're thinking in Medicaid and really what we're trying to do about it. And I don't want to spend too much time responding necessarily to Rosalind's presentation from the Hospital Association. I think it was well done and it summarized their arguments well. But what you didn't really hear much about in that whole conversation was about health. And look, the hospitals are some of our biggest partners right now. And one of the things I'm most proud about is that since we came into office, the agency has specifically changed its mission to make sure that we're recognized as the leading health agency in the state. Because we have $6 billion right now to spend on behalf of health. And the question is, are y'all getting our money's worth to do that? It's really the national question. I mean, that's what we're talking about nationally. That's why we're going through all this. And so we're working very closely with doctors and hospitals and so on, some great things. And a lot of people in this room to get more kids covered, to work on improving birth outcomes, and we've done some really amazing things with the hospitals and doctors over the past year. But what you don't hear a lot of talking about in that previous presentation was really health. You hear a lot about the money, all the money that's going to come to the state, and that can't really be our first concern. Our first concern shouldn't be the jobs argument in South Carolina. The last assessment that was made by the same professor 2 years ago when we were cutting several $100 million from Medicaid was that the state would lose thousands of healthcare jobs. Well, we cut several $100 million from Medicaid, and in the past 2 years, healthcare jobs have grown in the state. They projected we'd lose 5,000 jobs. They've actually grown by about 6,000 or 7,000 jobs. And that's really the point, is that healthcare keeps growing and growing and growing and growing, and every year they tell us, if you just give us more, we'll get people healthier, and we'll create more jobs, and more people will be covered, and we'll all be healthier. But that's not what's happening in the United States. What's happening in the United States, if you believe the Institute of Medicine, is that healthcare is growing at such a rate that it's crowding out all the other important investments that we need to make that we know truly drive health. I mean, for public health people, you understand the social determinants model, that 80 to 90% of health is everything else but health services and health insurance. It has to do with income and education and social supports and personal choices and genetics and environment. And yet, healthcare spending has gone out of control. I didn't bring the slides, but you all know it's taking up more and more of every individual's dollar, every family's dollar, every employer's dollar, every government's dollar. And it's doing 2 things. One, it's depressing economic growth in the United States, and it's depressing wage growth in the United States. And it's also crowding out investments in other important things like education, like roads. Just this week in the article next to the Medicaid expansion article about all the jobs the hospitals are going to create was an article that said we need $28 billion in the next 10 years for roads in South Carolina. And so, you know, these are things that we have to be concerned about, and most people are concerned about this growth. And what we're not doing by talking about all the jobs we're going to grow and how much money is going to come into South Carolina is addressing that problem, is that we're spending too much money. We're spending too much money on health care services and health insurance, and we're not spending enough money on the things that really drive health. And so this map is a map of adults on Medicaid. Every single person in here, this is geocoded. There's 100,000 little dots on there. These are people who all have insurance already, who are on Medicaid. And so insurance isn't a problem here. Everybody's got access to insurance. But what this map is a map of a collection of diseases. The most significant diseases that we all know, COPD and chronic heart failure and asthma and so on, that affect these adults. And what you see in the deep blue areas, that's good. Those people are 2.5 times, or 2.5 standard deviations healthier than the average Medicaid recipient in the state. And when you see that deep red, those are people who are 2.5 standard deviations sicker than the rest of the Medicaid recipients in the state. They both have Medicaid. But there's 5 standard deviations separating the folks in Greenville, Spartanburg, Lexington, and Berkeley and Charleston from the folks who are in that area we all know has incredible problems, which is the PD, Darlington, Marlboro, Dillon. Those people all have insurance. And so the question is, well, wait a minute, if insurance solves all these problems, why do we see these huge disparities here? And what we're arguing is that insurance doesn't solve a lot of these problems. That the reason that people in Greenville, Spartanburg are healthier has a lot more to do with when you look at the underlying statistics about things like obesity, about the number of households that are headed by a single parent, by poverty, by the number of people who have graduated from college, not high school, but college. And you dig down, and those are social determinants that both state and local and federal government have important investments to make to contribute to a lot of those social needs. And what instead has happened is that we said, well, if you just get everybody insurance, that will solve these healthcare problems. But this is from USC's Institutes of Family Society, who does all of our research, and they're saying it's not working. There's a study out by the CDC a couple of weeks ago that just basically talked about the number of people who have hypertension in the United States, and it's about 66 million. High blood pressure is like one of the worst things that can affect folks. Probably a lot of people in this audience have it. The shocking number is not that 36 million of those people have out-of-control high blood pressure. I mean, more than half. More than half of people have out-of-control blood pressure. The shocking thing is that 90% of those people have a regular doctor that they identify, and that 85% of them have health insurance. Okay, so we're paying all this money to doctors, we're paying all this money to health insurers to work on health problems, and probably one of the #1 killers in the United States. You believe the CDC? It costs $130 billion extra a year because of out-of-control blood pressure and countless death and morbidity. The health system's only able to get it right 1 out of 2 times. Okay? So the question isn't, if we spend money, will we get people insured? The question is, if we spend money, will we get people healthier? And a lot of the analysis you see is, oh, we'll get $9 for every one we spend, it'll bring all these jobs. But even the folks who support Medicaid as a way to improve health, and I believe that insurance improves health. Don't get me wrong. I'm not one of those folks who believes that insurance coverage doesn't improve health, and I'm not one of those people who believes that Medicaid doesn't improve health. I wouldn't have come to South Carolina to run a Medicaid agency if I didn't believe that. But what I do believe is that it's got to be compared to something else. And when we look at maybe where else we could spend money in South Carolina is different than Massachusetts. Maybe in South Carolina we need to spend more money on getting people graduated from college. Maybe in South Carolina we need to spend more money first making sure that families stay together. Maybe we need to spend more money making sure that people have good jobs. Massachusetts doesn't have that problem, and so maybe it was right for them to go that extra mile for those last few people that needed that health care coverage. But maybe in South Carolina and maybe some other states, that's the right choice to make, is to make our investments elsewhere. But the Affordable Care Act says that our #1 investment for the next how many years has to be in health care. And what this shows is where all the illness is. These dark counties show where all the money is going to go under an Affordable Care Act expansion. And so it just pours more money into the areas of the state because of the way the model works. It's basically an insurance model. It pours more money into the areas of the state that presumably don't need as much help as the areas that are really sick. And what we're saying, that doesn't make sense. Maybe we need to spend 5 times as much money in those red areas as we do the blue. But the Affordable Care Act doesn't really let us do that. But it's not a public health model, it's an insurance model. So that's really our main argument. And so our plan addresses that. I mean, we've got to make healthcare better value. We've got to lower cost. We've got to increase outcomes. We've got to get people more involved in their health care because doctors can't solve it all. And we've got to work where the problem is. We've got to work on these red areas, and that's really how our strategy is driven. And so I'll leave you with that. I think I'm very proud of what we've all accomplished to date so far, because I can look at 10 different people in this room and focus on a health project that we worked on, focusing on health. We're not saying look, we should not be spending more. We're not saying that we should not be investing more. What we're saying is let's invest smartly for South Carolina. And so I'm looking forward to all your questions.
Thank you.